going over restless leg. This is a very big problem. It keeps you up at night. It prevents you from getting sleep. It can cause depression. It's been linked to shorter lifespans, unhappiness in life. So we're going over my favorite tips. Number one is go see your podiatrist. So this is the single most misdiagnosed disorder that I know of. A lot of people have issues misdiagnosing it. So what I mean is like 90% of the time when people come talk to me, what they really have is sore muscles, overworked muscles. They have tight muscles. They have diabetes with blood sugar through the roof. Like, I mean, 90% of the time, I feel like people who tell me they have restless leg syndrome is rarely. I'm not saying it doesn't exist. Because it clearly does exist. But I mean, I'll tell you, like 9 out of 10 times when people tell me this, you don't need medications, you don't need stuff like that. In my experience, this is not for everybody, but this is my experience. You got to get to the root of these with my patients is what I tell them. But that being said, I'm not discounting it because it clearly does exist in some people. So that's not to do conspiracy theories or anything. But in my opinion, it's one of the most self-diagnosed things because a lot of things can make your legs ache and throb at night, and it doesn't mean you have a nerve disease is kind of what I'm trying to say, even though this is a real disease. So what I mean by that is, what's the cause of this? It's hard to say. There's not a lot of consensus. So go see your podiatrist, get worked up with labs, get x-rays, get an ultrasound, get your blood flow checked. That's a big one. A lot of people with restless leg syndrome really have narrowed blood vessels, a couple changes in medication, or us working with a vascular specialist can open up those blood vessels. There's a lot of options, not me specifically, but my vascular surgery colleagues can do that. And that can make a huge difference. So here's the tips is number one, think about how you're sleeping. So what I'm a big fan of is you want a cool room. So generally, I know studies show like in the 60s can be very helpful for sleeping. So that's one thing. Another thing is you don't want light in your room. So things like night lights and lights on outside the room have been associated with poor sleep anyway. That's something to consider. You want some type of noise cancellation. There's a lot of evidence for that. So if there's cars outside your window, but as an example, these things can disrupt your sleep. And the less sleep you get, the more your legs are going to ache and the more stressed out you are. There's a link there. So it's almost like, does the sleep cause the legs to hurt or do the legs cause the sleep to hurt? It's hard to say. The studies aren't conclusive on that, but do everything you can and get comfortable. Another thing I like is avoid blue light. Studies really show that this will help you get to sleep well. Is blue light filters for your computer. There are free apps. Blue light filters for your smart TV. Like maybe if you're using an old TV, it's going to be hard, but I know there's even stickers you can paste over your screen that get rid of the blue light. I don't think you need to go that extreme. Maybe get a newer TV that can have a blue light filter setting. Might be an option, but those things will really help you sleep. Check out your health. So in my opinion is, are you a smoker? Do you have blood flow problems? Get that checked out at our office or with a podiatrist or with a vascular specialist, because a lot of times nighttime pain when your legs are lifted up, it will make your legs achy and spasm if you're not getting enough blood flow. That's not a nerve condition. That's not restless leg. That's called claudication from the lack of blood flow. That's a separate issue. Get that evaluated. But one of the more common things I see in my older 60 plus patients. So the next thing is, are you on your feet all day? Are your feet really sore? So what that means is if you're sore, your legs will swell and stretch your nerves at nighttime. It's not really restless leg, but it will make your legs restless. So what I like to do here is massaging and stretching. Those are two of my favorite things. Do that in the morning when you wake up and do that before you go to bed and get some good support for your feet. This isn't for everyone, but for a lot of people, this could really improve nighttime pain. Take a look right here. My right foot can bend up more than my left foot. So I've had some injuries. I tore my hamstring, so I don't have equal flexibility. And this is true for everybody. You're not equal. Your muscles work differently. You're a little bit off balance. This causes some muscles to get more sore, more swollen, the nerves to get more stretched out, and then they can ache when you're resting at night and when they're swollen. So take a look right here. My feet are not equal. So this is the whole point of the massaging and exercising. So freeze a frozen water bottle. Just be careful that it doesn't explode and massage all your muscles. So right here, I'm massaging my plantar fascia. These balls don't work great on the bottom of your foot, but they can work great on your calf muscle, on your hamstring, on your chest, on your butt muscles. For the bottom of the foot, these rubber balls that you can stand on, they work great. On a soft surface like a carpet, you have your softer ones and your harder ones. It should never hurt. Let me repeat, should never hurt. I love the massage roller stick. Simply getting something like this online, it'll massage your muscles, your hamstrings, your calf muscles. For most people, it's their calf muscles that get sore for restless leg type symptoms that I see. Your perineal tendons right here on the bottom. Don't do it on the bone because the bones will hurt. So like on the front of your shin. So see on the bottom of the foot, it's probably easier to use a ball. Then after you massage for a minute or two, then you do some light stretching. So your hamstring, your calf muscles, if you can't reach your toes, which most people with nerve pain probably can't, use a towel. You can use some elastic bands. This stuff is extremely helpful. It's very beneficial. I love doing this 1 to 2 minutes for a massage, 1 to 2 minutes for a stretch. A great option for nighttime pain is using something like BioFreeze, and we link that below. But BioFreeze or menthol creams can be very effective. What these basically do is when you lather some on or roll it on, it makes it very sensitive. Then after about a couple minutes, there's no sensitivity at all. And a lot of that nighttime restless leg syndrome type pain goes away. That works great. The next thing is, look at, without orthotics, look at how much your foot flattens out. As your foot flattens out, it stretches the nerves, it stretches your calf muscle. Like this guy right here, look at, this guy stretches quite a bit when your foot moves. What you want is a good supportive shoe. So you want a good supportive shoe, and you want a good supportive orthotic. So specifically, look at, it doesn't compress, whereas without the orthotic, look at how much it compresses. Shoes, orthotics, we got them down in the show notes. I won't spend too much time on that because there's a lot of stuff to cover in this guide. One thing as well is good home slippers, good sandals. You want good supportive ones. Check out down in the show notes. This stuff really works well. It does a great job. Foot and ankle massage devices. You should get some type of compression device. There's calf compression devices and there's full leg compression devices. The older you are, the more unhealthy you are, the more you need these things. So specifically, any patient that's in a hospital bed has to have these because studies overwhelmingly prove if the flow's not circling because your muscles are not moving, then you're going to get bad electrolytes built up in your legs and they're going to stretch. That's not healthy for your nerves. That can cause blood clots, narrowing the blood vessels, and it could cause compression and nerve problems. So you want compression devices if you're having restless leg syndrome. I personally use these at the computer. It makes a huge difference. My legs feel better. I'm less tired. Same thing with the TV. You know, it's going to make some noise as it's pumping. They make a big difference. I link some of my favorites down in the show notes. They make a big, big difference, especially if you're not moving. For anybody who's sitting on a computer, I personally recommend to my friends to use these things. Warmth. So before you go to bed, heating pads or warm soaks. You can fill up a tub of water and soak your feet for like 10-15 minutes. You can get a heating pad. That works extremely well. Gets the restless leg syndrome feeling a lot better. Vitamins. So vitamins that help are iron. You can get those in the diet, eating your meats and your greens. Vitamin B, you can get this in a daily multivitamin, but vitamin B has been shown to help with these. Vitamin C as well has been shown to be very helpful. So you can get this in a supplement. So just taking a daily supplement. Don't get too crazy. You don't need to buy like $100 anti-restless leg syndrome pills. This is going to be a quicker routine here, but when you get up in the morning and you're tight or at night, just rotate your ankles a little bit. So I like to warm up, you know, rotating your ankles, get the blood flowing, loosen everything up a little bit. You know, ideally you would have done the massage earlier and I show why you want to do this, but now you can use the towel and just stretch your foot back, stretch your hamstring. So right here, I'm just going to hold it for, 15 to 30 seconds just to loosen you up. And consistency is the key. It's not going crazy and doing half an hour every day. It's just doing a couple minutes every day and keeping up with it. This is probably my favorite stretching exercise. Put a towel under your feet so it's cushioned and the ball of your foot doesn't hurt. And what you do in this case is you just use your body weight. It stretches out your hamstrings, your calf muscles. But again, it should not hurt. You don't have to go crazy. You don't have to do anything that hurts you. I love the massage board right here. This is my favorite one out of all the stretching supplies. I'm showing it here barefoot, but it could hurt your foot, especially the people having nerve pain, restless leg syndrome. But the idea is you want to measure your progress. So see how this moves from about 15 degrees all the way to about 45 degrees on the last level. So see right there, that's supposed to be about 45 degrees or so. So I love the ankle stretch board. That's probably my favorite one. I like using that. Hey, if that helped you out, do us a huge favor. Give us a like, give us a subscribe. It really makes a big difference in the YouTube algorithm. And here's some more videos that you may like. Thank you. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.